series, and we are concluding with the Jida Al-Hajjar. I've known Jida while she was doing her PhD at Maisonneuve-Rosemont Hospital. And since she graduated, she went on, built a career in patient services, clinical services. So I'm going to leave it up to her to tell you more about her career path and her interest in STEM. The session today is going to be different in the sense that it's going to be more conversational. There's not going to be any slides. So Jida will first present herself, and then we'll open the floor for discussions. It's very casual. So it's all yours, Jida.
Thank you so much, Bara. I'm very happy to be here. I'm very happy to share my passion and my career in STEM. And as Bara mentioned, I like to have this presentation the most interactive possible. So I will present myself, and then please ask me your questions, what is really you are eager to know, and I will answer your questions. So to start, I'm Jida. I have moved to Montreal 12 years ago. I moved here to secure a better future for myself and to pursue my dream in science, but also in learning models of care in a place where I know where the research is happening and changing the ecosystem. So I came here, joined the PhD program at the University of Montreal. I worked on Alzheimer's disease. And after I finished my PhD, I was interested to work in patient care, like direct patient services, as Barat mentioned. And unfortunately, at the time, uh, finding jobs like clinical research or more healthcare oriented jobs in Alzheimer's disease or other neurodegenerative diseases, it was hard. There was not much research happening or clinical research happening in that field at the time. So my career path took me to oncology, and my first job was at the Jewish General Hospital, where I worked in clinical research, first in human and phase one trials. And for you to know about clinical research, phase one is really the hardest in terms of um, work. It's very demanding in every aspect in that work, because the drugs, first of all, they're being administered for humans for the first time sometimes, and so we have to be very careful in checking all the side effects and reporting every side effect that we consider severe to Health Canada and to the pharmaceutical company, etc. So it is a bit stressful, but at the same time, the learning that you get from a job like that is huge. And all the skills that you learn in a position like that, you carry it with you in all other jobs. So I worked there for 2 years. And then also, what's interesting when you start working in a clinical research is that you get to be exposed to all the clinical research ecosystem. So I was working in a hospital, but at the same time, I was working with pharmaceutical companies, with clinical research organizations, et cetera, et cetera. So you get to develop that network, and you get to know what kind of job opportunities you can get in the industry side, so in the pharma side or the clinical research organization side. And so I got offered a position in a CRO. So I went there, and this is where I wanna tell you, you never know what you like and you don't like until you try the jobs. So I knew I loved like my first when I finished my PhD, I knew I love science, but I want to work for patients and see the impact being more concrete with patients. So that got me to the clinical research job. Then I learned, oh, would I love working in industry or pharmaceutical? But then I wouldn't know if I didn't go there. And when I did, and that's me personally, but other people will love working in big organizations like pharmaceuticals or clinical research organizations. I didn't. I found myself, it's highly regulated. You know, you have to follow lots of processes, lots of administrative models, which for my personality, it didn't fit. Uh, but you have to try. You have to try if you like it or not. And if I didn't try it, I will have probably still till now think, oh my God, you know, I didn't go to pharmaceutical. I didn't try the CRO. So my advice to you is to try. Don't say no to an opportunity unless really it's against your values, against what you really care for. Jump, take the risk, and you will learn. Every opportunity is a learning curve. So I worked there for almost a year, and I didn't find myself really in that in that culture. So my boss at the Jewish told me, "Hey, I would love to get you back." So, but it was in a different kind of a context. So there was a new program that is being developed at McGill called the Rossi Cancer Network. So it was specific to work on projects in the healthcare system. So it's still patient oriented, still in oncology, but it's different than just pure clinical research. It's really what we call quality of care research. So you do projects and to improve the quality of the care oncology patients receive in the hospital. And to do that, you have to follow indicators. For example, you have to follow are patients who are diagnosed with breast cancer receiving their surgery within 28 days, like it is recommended by the Ministry of Health, for example. So the job would be, okay, let's measure. So it's a lot of data analysis. You have patient data that you need to analyze. You have to look into what kind of factors influence that there might be a delay to get the surgery or not, and what are the delays. And look into if we're matching that target, and if we're not, what can we do as an intervention to match that target. So it's very stimulating. Um, and it opens as well the doors for other types of opportunities. And I was very happy there. I wasn't looking for switching jobs, but as I said, when an exceptional opportunity come knocking on your door, you have to you have to look into that opportunity. And as a headhunter on LinkedIn uh, offered me the position that I have currently. I've been there for 3 years and 4 months now at the Quebec Breast Cancer Foundation as VP of Investment and Health Promotion. So I manage all the investment portfolio of the Quebec Breast Cancer Foundation, research programs, patient support services that we offer for people affected by breast cancer, education and awareness campaigns as well. And I advocate for patients with the government or with other entities that are important for the patients. And here I am today sharing my path. So I would like now, if you have any questions or you wanna like guide the conversation, I am all ears.
So who will initiate the first question?
I have a question. Oh, yeah, go ahead.
Go ahead, Mia. Yes, Mia.
Hi, I just wanted to ask you, what does a typical day in your work look like?
In my current position, it's changing hats every hour. No, but to be honest, it's dealing with if anybody, like, you know, we have financial assistance programs, we have a social worker who responds to patients calling the foundation if they have any questions. So it's mainly if any problems emerge or questions that we don't know, as we have to deal with that and meet with them, try to find solutions together if there's any issues that came up. It's also meeting with several people externally or internally, developing partnerships for the foundation to bring in important partners that can leverage our impact, our investments. So it's also, I have every day several meetings booked with different people. It's also doing a lot of strategy planning, because when you get to a position like you as an executive in a foundation, you have to do a lot of strategy planning. Okay, where we want to go, what is happening right now, what are the unmet needs, and where do we want to bring the foundation in for the next 3-5 years. So also lots of strategic um, meetings that we do with either my colleagues or also people outside the foundation. So high level.
Yes.
Hi, I'm Katrina. I just wanted to ask, what obstacles did you face in your career and how did you overcome them?
That's a really good question. Uh, I shared maybe, everything is fine and went well, but for sure you have a lot of issues that come up with every position I had. There were issues. For example, the clinical research, when you deal with cancer patients, and in this position, you get to deal with them on a weekly basis. You meet them, you meet their families, and it gets to be heavy. And if you don't have somewhat a strong personality, emotionally, it can be heavy emotionally to deal, when they pass away or when they're not responding well to the treatment. So that was a heavy aspect of this position. But how you overcome it? By communicating, like, you have services, you have colleagues that also have to deal with, so you just need to talk about what you're feeling and not keep it to yourself, or else it might really affect your family life as well. um, I can give you another example. In this position, the main barriers are always uh, political. Like, sometimes, there's competition, and that's in every job, but the more you get in a higher position, the competition gets higher and higher. So, in a foundation, everybody, we rely on fundraising. So you need to get strategic partners so that you keep having revenue generation. And your competitors might not want to work with you or find, uh, uh, the Quebec Breast Cancer Foundation, for example, is more visible than us, so we don't want to collaborate and stuff. So you have barriers like this where you need to be very smart and wise to keep the negotiations, and you'll develop a lot of negotiation skills in that way to actually get to what you really need to survive and to continue your mission. Yeah.
Yes, Maxine.
So, what major did you have in university to like get where you are now?
So my higher degree, it was a PhD in molecular biology, and it's important to pursue. Personally, I encourage to get to the highest degree you can get, specifically in science, because a PhD, yes, you'll understand you have a project that you have a hypothesis, and you have to prove the concept, you publish articles. So that are the concrete deliverables that you get from the PhD. But what is more important, I find, is you learn a lot of skills. You learn a lot of how to deal with difficult personalities. I'm not gonna lie to you, not all principal investigators or university administrators are, some people have more harder personality to deal with. So you learn how to develop skills to manage more difficult personalities. You also develop skills on how resilience, like we talked about it a lot this year, but you know, it's hard. It's hard to prove a concept. It's hard every time you learn something new. Your hypothesis is needs to change or needs to adapt to new knowledge you got. So, but how you continue being resilient to get to your outcome, which is finishing your PhD and getting the publication. You also have to deal with time scheduling. You organizing yourself. So a lot of soft skills that you develop while doing your PhD that's not only related to science but also to like life and other careers that you're gonna carry after. The main one that I would say is the problem solving. Like we are always and constantly problem solving while doing our master's or PhD project. So that is actually a skill as a PhD or master student is extremely important in all jobs you get later. And that is something I always had as a feedback from the bosses I had in after. When there's a problem, we don't alarm, we don't panic, we don't, okay, let's think of a solution. And that is extremely important. Yeah.
Hi.
Sheridan? Yes.
Hi. So you mentioned that your job can sometimes be stressful. Like, how did you find ways to deal with that stress and kind of detach, I guess?
Wow, I'm having great questions today. Um, Several things. So, stress, if you know what is the cause, because stress can be because either I didn't expect that thing and all of the sudden, oh my God, how I didn't perceive this and it happened and you have to deal with it right away. Or it's a crisis management, something happened and it's a whole crisis that you have to deal with. I think the more you get to be exposed to various situations, uh, the stress level becomes less, or maybe it's still there, but you deal with it better. So I think my answer to you first is with experience, and it's okay that at first you feel overwhelmed as long as you make sure that it doesn't make you dysfunctional. So it's okay to communicate, hey, okay, my it's a bit this is like this situation is new to me and I have to think about it. It's okay. I did that too with my like in my first, just something new I was learning. And it's okay as long as you're being transparent with it. And the more you go through various situations, you'll learn how to deal with that and how to be quick in finding solutions. But on a personal level, uh, for me, I found out working out. I work out every day in the morning or in the evening. That's my way to get the stress out and zone out, like get my mind to think of something else. Uh, that what worked for me. So I know when I don't work out, the stress level gets high again. So I make sure now in my schedule that I don't skip because it's no longer, oh, it's just a habit like it's a hobby. No, no, it's something that I need to do for my well-being, my family's well-being, and the well-being of my employees. Um, so that what worked for me. But if you find anything that make you zone out, that make you think else, don't think of the problems, don't think of the issues you have at work, you need to do it. Like take a walk, take a long walk, go or go paint or whatever it is that makes you zone outside for a couple of hours, and then you can come back to your issues or what you have, and you'll be more efficient and you will be more calm.
Thank you.
Yeah.
Yeah, you knew? Go ahead.
What kept you motivated during your studies?
um I guess it was, I said I had no choice but to get through this and to succeed in what I'm doing. Like, and that's why I started by the fact to say I moved 12 years ago, because I didn't want that this big experience that lots of people, immigrants that leave their home country to a new country and wanna build their future, and that was the main reason why they left the people they love, their family, their friends. I just I said it has to make it has to be for an important reason, and I can't be I said like especially the first year, like there was a lot of crying, a lot of nostalgia. It was rough on the spirit, and I said I can't be that I passed through all of this for not succeeding at the end and not making sure I'm gonna get to at the end to the end of my studies and later on to build a career here. So I guess that's what kept me going and that's what motivated me. I'm loving
Other
all the
questions?
questions.
Yeah, go ahead.
Yeah.
Yes.
Did you have any other interest other than STEM? Like, if so, how are you able to choose STEM over other things?
I'm gonna be very honest. Maybe I did sometimes have some ideas like what if I went through that field instead of that, but I realized that every time I think of it very much in depth, I realize that STEM is where I it's even in my DNA. Whenever I want to read a story or read a book or read articles, or this is where I go, and it's not because I don't want to look into other things. It's just this is where my passion is, and I grew up with two aunts who are scientists as well, and I think it's just going with them when I was young to the lab and them explaining to me all the chemical reactions and doing all the like lab things got me it just became so much into my DNA that I never thought of any other field.
We have time for one or two questions.
I have a question for you. So I heard you're gonna start CEGEP next year. Is that correct?
Yeah, for the grade 11s.
Okay. And everybody here is interested in STEM?
Well, I'm going to a STEM related. She's going to law. Like, yeah, we're a bit like diverse a bit, but yeah.
Interesting.
You can definitely do STEM and law.
Yes.
It works
Oh,
out
yeah.
great.
Carmela is an example. That's true. So
There's the
okay.
McGill genomic policy program that is super interesting. Yeah, I mean, now science is evolving. We're getting into precision medicine. The patient data is everywhere. So you need to have a law that is evolving to protect all that data sharing.
Last minute question. Okay. Thank you, Jida. Today it was very interesting and interactive. Thank you for sharing your journey. And I think for you girls over the series, the recurring theme is always it's not a linear. Your path is not linear. Things will change. Challenges will come up, but just go through it. You can do it, and whatever the opportunity comes up, take it on. It's whatever you choose. If you decide to do science now and then after that you decide to go into business, law, art, there's always opportunities to grow in whichever space you decide on. So you don't need to make one decision and stick with it for the rest of your life. And you might like one thing today and tomorrow you can say, no, I want to do something else. And that's perfectly normal. And I hope the speakers over this series have shown you that everything is possible. And
Exactly. It's like
okay. Yes,
this, never linear.
exactly. Mariam, you had a question?
No, we just wanted to thank you so much for doing this and coming to talk to us. And yeah, thank you for inspiring all of us with like what you do.
Thank you for inspiring
participating.
me.
But like now it's class started. So
Yeah,
we have
that's
to.
okay. Well, thank you everyone and good luck on your exams.
Thank you so much. Bye.
Bye.
Thank you, Carmela. That's good. Sorry, you were saying something?